I'm going to paraphrase a story here that happened to one of my patients a few years ago. And this is a story, that you're not going to hear anywhere else because the press doesn't want to cover a story like this. But it is a story that I talked about with one of my patients this week, and I think it's an interesting story. It's a story that starts a few years ago when one of my patients turned 40 years old. And of course, the recommendations at the time, and of course now, is to get your first mammogram when you're age 40. This person did not have any kind of risk factors at all, no family history, nothing that would tell me or tell this patient, hey, you are even in a medium risk group. Forget a high risk group. So she gets her mammogram at age 40. I get the results back. I call this person back in my office a few days later. And I say, hey, you got your mammogram. That's great. Your exam was normal. Everything was fine. But this mammogram report, it's not exactly normal. I don't want to say it's abnormal. I don't want to say there's a spot. I don't want to say there's a mass. But it's not conclusive. It is inconclusive. We need to get more images. And in fact, they're recommending 3 additional images to help clarify what's looking like a shadow there. It's not really a spot or a mass. We need to get more information. And at the time, it took about 2 weeks to schedule these additional tests. So, and this is somebody who is completely healthy, no risk factors, very healthy. Took a while to try to get through that process, to get through that, to get to that point, to get to that decision. I've very much summarized that visit, which took a while, which I don't mind, but it took a while. Those 2 weeks go by. This person gets these additional images for her mammogram. Comes back and sees me. I said, good news. All those additional pictures that we got, they were fine. They were okay. But they're recommending another mammogram in 6 months to make sure everything's okay. She was like, 6 months? I thought you said everything was okay. I thought we just go back to, every year or every 2 years. That doesn't really make sense to me. So again, we go through the process there trying to explain, that there could be some, some shadowing there and I don't really think there's a mass there. I don't think we have to get real aggressive to get a biopsy, to refer you to a specialist to get that thing biopsied. We just want to wait 6 months and get another mammogram. So she says, fine. In the course of that 6 months, this is a small town here. I see that person around town every once in a while. I just kind of ask her how's it going, and understandably, she's a little bit nervous about it. So try to answer some more of her questions and try to reassure things. 6 months go by. We get another mammogram. A couple of days goes by, comes back in my office. I said, hey, okay, these are your results. We have to get more pictures this time, too. What? What do you mean we have to get more pictures? So I go through that whole thing again. We get the more pictures. Bring her back in my office. This is a couple of weeks go by. You know what? I think there's something there. I think there's something there that we have to biopsy and make sure that it's not cancer. He's like, why didn't you tell me this 6 months ago? I didn't think there was anything there 6 months ago. Now I'm concerned about it. So we refer her to a surgeon. We refer her to a specialist. Takes about a month to get into a specialist. Goes to see the specialist. After she goes to see the specialist, she calls me. They're gonna schedule a biopsy. The biopsy is scheduled for a couple of weeks later. The biopsy is done, and it takes a couple of weeks for the results to come back for me to tell her, is it cancer, is it not cancer? Because, of course, if it's cancer, we refer her to a cancer doctor, chemotherapy, radiation, all that stuff. Before the results come back, I get a call. I'm seeing some redness where they took the biopsy. Comes in and sees me. Because the surgeon somehow was out of town. I'm thinking there's a little bit of an infection there. Go ahead and start antibiotics. I was seen in my office a couple of days later. A couple of days later, the infection is getting worse. We have to put her in the hospital to start IV antibiotics. So we get all that treated. She gets discharged from the hospital. Everything's fine. There's no infection there. Comes back and sees me. You know what? I got the results back. You don't have cancer. No cancer. That's good news, right? She was like, why did I go through all of this? Could it have been avoided? I don't know. I don't know. I mean, it's frustrating. And she told me, she was like, I will not have another mammogram until I'm 50 because I am not going through this again. This is too much. All that for what? What does it do? It was a waste of time, she said. So that is the other side of things. And I have read these reports. I've seen the news programs. People are making fun of the reason that is given that these mammograms are not being recommended because it causes anxiety. I've seen it. It makes people very anxious. If you tell me to wait 6 months to tell me if I have cancer, I mean, just imagine that. That is, that is, I can't even imagine going through that. So that is briefly just kind of me on my soapbox talking about the other side of these breast cancer recommendations.